With the COVID-19 pandemic placing increased pressure on our financial situations, 1 in 10 young adults are cancelling their private health insurance to cost cut during these uncertain economic times. Joining me today is Dr. Rachel David, the CEO of Private Healthcare Australia, the private health insurance peak representative body in Australia, to discuss the increasing trend among young adults. Rachel, why are increasing numbers of young people cancelling their private health insurance?
Look, I think what we've seen actually since 2020 is the number of younger people taking out private health insurance or keeping their parents' private health insurance has actually increased a little bit. But you're right, that is off the back of some years of younger people disproportionately dropping out of health insurance. But what we're seeing is because the health insurance system we have in Australia, which is called a community rating system, because everybody pays the same premium, regardless of what their risk is, it means that young people often end up paying quite a lot of money for hospital cover compared to what they might need, whereas older people pay the same amount of money for their hospital cover and they're actually getting a lot back. So under the community rating system, it is fair if you pay into it over a lifetime, because eventually you will probably use just as much as you put in. But for young people taking that first step, it does seem like a lot of money, particularly when compared to things like taking out a mortgage. And it's a difficult decision, particularly for folks who might not have their family around to help them.
What risks do young adults face from cancelling their private health insurance?
One is that at the moment, particularly because of cancellations due to the pandemic, it is very hard to access elective surgery in the public sector. The other issue is mental health. The public sector does a great job of looking after people with really serious, life-threatening mental health conditions like schizophrenia or people who are an immediate danger to themselves and others. But in 4 areas: chronic depression, chronic anxiety, eating disorders, and substance dependence, the public sector offers very little. And we find that mental health is the main reason why women aged under 35 claim on their private health insurance. That overtook reproductive health some years ago. And it's actually the second major reason that young men claim on their private health insurance. It's only just overtaken by sports injuries in young men. For many of those, as I mentioned before, it can be quite difficult to get timely access to care in the public sector.
And why is private health insurance so important, especially during the COVID era?
Well, look, I think that, some of the pressures on the public system that I've outlined are really what's driving people to hang on to their private health insurance at the moment. Because of the cancellations and the lockdowns, it is very difficult to get access to anything other than an emergency surgical procedure in the public sector. So if you're, at imminent risk of disability or death, yes, you will be treated in the public sector. But if you have something that can wait, you will go on a waiting list. So access to surgery is a big one. And the other issue is, of course, the rising rates of mental illness. And we are seeing claims rise, particularly in younger people. We have seen an increase in people with anxiety and depression who have considered self-harm as a result of the pandemic. I don't think it's hard to imagine why that is. We've had the Brain and Mind Institute in New South Wales do some very detailed predictions, and they've said that long after the pandemic is over, we'll still be dealing with the mental health challenges that they're faced during this time. So we are seeing that going up, unfortunately. But what we can say is that in the private sector, the immediate access to care is what motivates people to stay in health insurance.
Well, thank you for joining us today. And for anyone looking to cancel their private health insurance, it's probably best to do your research first.
Pleasure. Thanks for getting in touch.